Hey everyone, and welcome to MediByte. Today, we're diving into a potentially serious infection that might be a lot closer than you think, especially if you're a fan of the great outdoors. We're going to be talking all about leptospirosis. You know that feeling? Maybe you're out on your favorite hiking trail right after a good rain, or you're about to take a refreshing swim in a lake. It all feels so peaceful, right? But what if I told you there's an unseen world in that water and soil? What kind of danger could possibly be hiding in these places? Well, the answer is a microscopic organism. It's a spiral-shaped bacteria, kind of like a tiny corkscrew that's known as a spirochete. Its name is Leptospira, and it's the culprit behind the infection we're breaking down today, leptospirosis. Okay, so to really get a handle on the risk here, we first need to understand where this bacteria actually comes from, and, more importantly, how it manages to spread to people. So this is it, leptospira, and that word spirocate is just a way of describing its very distinct spiral shape. Now what's wild is that it's carried by a whole range of animals. We're talking both wild and domestic. And it absolutely loves to hang out in damp soil and freshwater sources, like lakes and ponds, where it can actually survive for weeks or sometimes even months. How it gets from an animal to a person is actually pretty straightforward. It all starts with infected animals, think rats, dogs, or even farm animals, who pass the bacteria in their urine. That urine then contaminates the soil or water around them. And here's the key part. Humans don't usually get infected directly from the animal, but from coming into contact with that contaminated soil or water. This chain of infection means certain groups are definitely at a higher risk. For farmers and sewer workers, it's considered an occupational disease. But, and this is really important, in places like the US, most cases actually happen during outdoor activities, swimming or wading. And that risk, it shoots up significantly after heavy rainfall or any kind of flooding. So now that we know how it spreads, what does this illness actually feel like, if you get it? Well, the symptoms of leptospirosis are pretty distinct, mainly because they often show up in two separate phases. Let's walk through a typical timeline. After you're exposed, there is an incubation period of about 5 to 14 days where you feel totally fine. Then, phase 1 hits, and it's usually a sudden flu-like illness. Now, you might start to feel better after that, but for some people, the story isn't over. They can enter a second and often more serious phase. Let's break these two phases down. Phase 1 feels a whole lot like a bad flu. You get a sudden high fever, chills, and some really severe muscle aches, especially in your calves and lower back. Your eyes might also get super red. But phase 2 is a whole different ballgame. It's actually driven by your body's own immune response. And this is where more serious complications like meningitis can show up. And in a small percentage of cases, things can get much, much more serious. This severe form can be life-threatening because it actually starts to attack major organs. And this severe version, well, it has its own specific name. It's called Weil syndrome. This is the most dangerous form of the disease, and it happens during that second immune phase. The three classic signs are jaundice, that's a yellowing of the skin and eyes from liver damage, followed by kidney failure, and a tendency to bleed, which can range from nosebleeds to much more serious internal bleeding. And this is exactly why early detection is so important. While most people recover, the mortality rate for those who develop that jaundice from Weil syndrome is somewhere between 5 and 15%, and that risk gets even higher for patients over 60. Okay, so with such a wide range of symptoms, how do doctors actually pinpoint leptospirosis, and what does the treatment plan look like? Well, diagnosis is a multi-step process. It always starts with your doctor looking at your symptoms and asking about any potential exposure you might have had. To confirm it, they'll use blood tests to look for antibodies your body has made to fight the bacteria, or sometimes urine tests to try and grow the bacteria itself. For a faster diagnosis, a PCR test can actually detect the bacteria's genetic material directly. The good news is that treatment is highly effective, and it's tailored to how severe the infection is. For mild cases, oral antibiotics like doxycycline work really well. For the more severe infections, you'll get stronger IV antibiotics in the hospital. And for patients with Weil syndrome, supportive care like blood transfusions or even dialysis for kidney failure might be necessary. All right, now for what I think is the most important takeaway from this entire explainer, how you can actively protect yourself and avoid getting infected in the first place. Prevention really just comes down to being aware.
The main thing is to avoid contact. Don't swim or wade in fresh water that could be contaminated, especially if the water is stagnant or it's right after a flood. If your job or hobbies put you at risk, wear protective gear. And since rodents are common carriers, controlling them around your home is always a very smart move. Now, for people who know they're going into a high-risk situation, maybe they're traveling to an area with an outbreak or for certain jobs, there is a preventative medical option. A doctor can prescribe the antibiotic doxycycline to be taken just once a week to help prevent an infection from ever starting. Ultimately, understanding the risks and recognizing the symptoms early is your absolute best defense against leptospirosis. It's all about being informed so you can enjoy the outdoors safely. So the question is, now that you know, are you ready to protect yourself? Thank you so much for joining us for this explainer. If you found this information helpful, please hit that like button, share it with someone who might need it, and of course, subscribe to MediByte for more clear, concise health explainers. We'll see you next time.